All passive range of motion assessments of the shoulder joint are completed supine, except for glenohumeral extension, which is completed prone. These assessments will be completed in two fashions, one with a blocked scapula to isolate glenohumeral motion, as well as one in which the scapula is allowed to move to assess full shoulder complex motion. Normative data is found in the supplemental PowerPoint presentation. Assessment for the glenohumeral isolated motion for shoulder flexion will consist of blocking the scapula at the lateral border. The goniometric landmarks for measurement are going to be the midline of the axillary midline down the thorax, the lateral epicondyle with a center of rotation around the acromion. Yeah, you can relax. Like this, once you feel some pressure coming from the scapula into your hand, you block that motion, bring it to end range, and you take a measurement. Following which you can just do full glenohumeral, full shoulder complex motion there. Glenohumeral abduction will be measured in supine as well. The goniometric landmarks are midline or parallel to the sternum, midline to the humerus, with the axis of rotation over the acromion. With blocked scapular motion, we block that motion at the lateral border of the scapula, just as with glenohumeral flexion. Once you feel resistance or pressure of that scap moving into your arm or hand, you'll just take the measurement there. And then you'll take a second measurement, allowing for full motion from the glenohumeral joint or shoulder complex. Glenohumeral external rotation will be measured also with the patient in supine with the arm abducted to 90 degrees. Glenohumeral goniometric landmarks for external rotation are the ulnar styloid process, and the proximal arm is perpendicular to the floor. Sometimes a bubble level is handy for this to keep things accurate with that. To isolate the glenohumeral motion, we're going to block that scapula again over the superior aspect this time, while taking an accurate measurement of external rotation. This will be followed by external rotation, full shoulder complex motion. Internal rotation of the glenohumeral joint, goniometric landmarks are the same as external rotation. The scapula will again be blocked over the superior aspect to allow for isolated glenohumeral motion as the patient's dropped into internal rotation. A measurement will be taken, followed by measurement of the full glenohumeral motion with the scapula allowed to move. Glenohumeral extension will be measured in prone, with the head rotated away from the shoulder to be measured. Goniometric landmarks for this are the same as flexion, being mid-axillary line, center of rotation around the acromion, and at the lateral epicondyle. The scapular motion will be blocked over the superior aspect. While the measurement is recorded. Following which, full shoulder complex motion will be recorded or measured.